Welcome back to Ronnie, I'm Joe B. Today I'll show you how to correct a pelvic outflare through muscle energy techniques and exercises. Let's dive in. Pelvic or iliac outflare is when the ilium gets stuck outward. The cause of this can be due to repetitive cutting and excessive iliac lateral rotation, hip lateral rotation, or toe out mechanism of injury, which can result to the anterior superior iliac spine to be more lateral on that side, the right lower extremity resulting to toe out during stance and swing phase of gait, and there's also a right unilateral sacral extension, as well as the lower lumbar spine would seem like it rotates to the left. Iliac outflare can bring about low back pain below the belt line in a rectangular pattern. Running, walking, and stair climbing can increase it. More importantly, the patient will feel that one foot is in a toe-out position during walking. The assessment for iliac outflare requires the patient to be in supine with arms at sides and feet at a hip-width separation. The therapist should be at the foot of the table on the tested side. From there, the right hip is medially rotated passively, moving the foot towards the body's midline. Normal findings is that the end range medial hip rotation will have a firm end feel, or a feeling that you are pulling on a rubber band and that you are able to pull towards a toe-in position. Abnormal findings of a positive pelvic or iliac outflare is when the hip is felt to suddenly stop or a hard end feel halfway the toe-in or hip external rotation total range of motion. To treat, let's assume that the right side has the pelvic or iliac outflare. The patient assumes a supine position with the therapist on the treated side. The therapist's right hand flexes the patient's right hip and knee, then rolls the patient to the left to allow the left lateral forefingers to be slightly medial to the right posterior superior iliac spine, or PSIS. After that, the right hip is moved back to lay on the therapist's left hand. The therapist's right hand then adducts the right hip, while the left hand pulls the PSIS laterally to encourage pelvic or iliac inflare. If a movement limitation is felt towards adduction, then the patient is asked to match the therapist's resistance towards abduction and external rotation. This is held for 6 seconds. Then the hip is further moved into adduction. This is repeated for 3 to 5 reps until the maximum adduction range is attained. Hook-lying bent knee fall-in exercises can be provided for the patient to reduce or eliminate likelihood of iliac outflare recurrence, since this exercise promotes iliac inflare, hip medial rotation, and unilateral sacral flexion, all to reverse pelvic outflare mechanics. This is performed for 2 sets of 10 reps. You can also progress this to a bent knee fall-in stretch for 3 reps, 30 seconds each, by crossing the left lower extremity over the right and going further into hip adduction and medial rotation as tolerated. So do you want to know how to correct a pelvic inflare? If so, then watch this next video. Thank you so much.